Hello, everyone. Thank you for this opportunity to share some of the findings from a recent research we carried out in northeast of India. The project was looking at forcibly displaced women, both internally as well as refugees who are taking shelter in two states, in Mizoram and Manipur, uh, due to different conflicts. Let me begin with the context in Myanmar. Since 2021, there has been a coup in the Chin state of Myanmar, which has led to a large influx of refugees within Mizoram and Manipur states with whom they had some cultural affinity. The Kuki-Chin Mizo community resides in these two states, which also borders the Sagaing division and Chin state in Myanmar, as is clear from this map. The region is quite difficult and also holds strategic importance for India under its Act East policy. But the challenges of infrastructure, health systems, poor indicators on maternal and infant mortality, poor vaccination coverage, limited access to healthcare, all of this define the challenges that these population groups have been facing over the last 2 years. Uh, in terms of the refugees who are living in Mizoram, almost there are 10,000, and the latest reports said that more than 80% of the people in need were women and children. In Myanmar itself, the situation with health was quite inequitable, where more than 40% Burmese children are stunted, many of the children are underweight, and suffer from high rates of acute and chronic malnutrition. The Chin and other ethnic minorities in Myanmar are also ostracized and have reported several human rights violations under the military regimes, and this has adversely affected their health outcomes as well. So when they come to India, Mizoram happens to be the only state which, because of its cultural affinity, has accepted these populations over the years. The Chief Minister health card allows basic access for health as well as education to these chain refugees in Mizoram. As part of this project, we surveyed more than 180 women and interviewed several pregnant women and mothers of young children, as well as had focus group discussions with them. And we found a lot of emerging needs, and the analysis from an intersectional feminism lens allows us to see how women and children are adversely impacted within this condition of statelessness. There is a lot of support through local organizations and community based groups such as Young Mizo Association as well. On the other hand, in the neighboring state Manipur, since 2023 and up till now, there has been an ongoing conflict between two ethnic groups, the Kukis and Meiteis, and that has also resulted in a lot of influx of internally displaced groups who have also taken shelter in Mizoram, and within Manipur, they have now moved to the hill districts. And even Manipur has very limited access to healthcare, and because of attacks on health infrastructure, there has also been reduced access to health in Manipur as well. So, a preliminary analysis of the findings shows that depending on the typologies of displacement, either the internally displaced or their places of origin, people tend to reside with either their friends or families or in relief camps in both Manipur and Mizoram districts. And a lot of them reported that they had lost their documentation during conflict, both in Myanmar and Manipur, and as a result, do not have access to the full services for the internally displaced. Whereas for the refugees, a lot of services in terms of employment, education, they still fall out of that. There is very limited access to humanitarian and government relief, again, depending on their ethnicity, and as a result of which, they rely on their social networks and kinship groups for not just health but other kinds of support. if we look at the different kinds of services that they have received, many reported that they have support in the form of relief food, but others also reported getting some kind of shelter assistance, either in relief camps or rentals in the state district capital as well. They've also received some financial as well as health related support, 30% and 46% respectively. However, there emerges to be a huge gap in water supply, sanitation, and shelter. 58% respondents say that water quantity was actually very inadequate to meet the needs of their family members. 30% said it was actually very expensive, and more than 60% say that they do not have enough containers to store water in their households. Menstrual hygiene also emerges to be a huge concern, and not everyone was open to talk about it during the survey. 17% of women mentioned that water points were very far away, they were afraid to access these water points uh, uh, due to trauma, and 67% of respondents maintained that there was not enough space for them and all their family members in the places where they now live. And during monsoons, it becomes very challenging because their houses are leaking. And many of these houses had clear, visible cracks on the roofs and on the walls. So, in terms of coping strategies, most of the respondents mentioned that they reduced the number of visits to the health centers, and almost 17% said that, whereas 40% mentioned that they spent from their own savings, and 41% borrowed money from their friends or neighbors or family members. 10% actually alarmingly said that they had stopped taking their medicines, while 19% reported relying on traditional medicines or traditional healers within their communities. In the context of this, it emerges that forcibly displaced populations are particularly vulnerable, especially women and children, and with fewer chances of them to go back to their homelands, allowing them to access these services that the government of India provides in terms of health, in terms of water, sanitation. There should be more policy inputs, both which allows the center and the state to take care of these needs. There is also a large number of reports of surveillance, which increases security risks, as well as does not address the health needs of young children and mothers. Most of all, conflicts in these regions are underreported, understudied, and the data in these regions are also quite difficult and challenging to find.